My name is Lisa Gladfelder. I'm in Advanced Health Assessment, Nurse 612 of Maryville University. This is my health and physical video. This is Angela. She has agreed to be my partner and participant in this video. Prior to coming in, I had her empty out her bladder. We took her vital signs for height and weight, which was within normal limits. We checked her vision with the Snelling chart and her near vision with the Roebuck chart, and it was fine. And that checked her cranial nerve too. I've washed my hands. She's changed her into a gown, and so we can proceed. As I'm going through this video, I wanted to mention that I will be inspecting her skin at all times, so to ensure that there's no masses, moles, make sure it's intact and it's pink, warm, and dry. So, hi Angela, I'm Lisa. I'm going to be your nurse practitioner for your physical today. I'm going to start with your head and we'll go down to your feet. So let's look at your head. I'm noticing her hair is nice, clean, and shiny. There's no flakes. There's no abrasions or bumps. I'm palpating your skull. It is what we call normocephalic, means there's no lesions, no masses or anything else. I'm coming back behind your neck to look for your occipital nodes, and there's no swelling. I'm going to come up now behind your ears for your post-articular nodes and your pre-articular nodes, and there's no swelling there. Now I want to check your cranial joint. So can you open your mouth real wide, close it? Okay. No crepitus, no pops or clicks, and that's really good. So now I'm looking at your whole face. It's symmetrical. The eyes are symmetrical. The eyebrows are even. I'm looking at her ears, and they are in line with her eyes, like they should be. I'm feeling for your frontal sinuses and your sinuses. Are there any tenderness there? No. Okay. That's really good. I'm noticing there is some dark circles around her eyes, but again, she has a 7-month-old baby, and that's to be expected. I'm going to check your gingiva in your eyes. They're pink and moist, and there's no lesions or masses. I'm checking your lacrimal apparatus, and it's nice and soft, and there's no drainage coming from the ducts. So I'm going to palpate your nose. Her nose is midline, and there's no masses or anything to be concerned about there as well. So next, what I'm going to be doing is we want to do a sensation test. So I'm going to use this cotton swab. I'm going to swipe it at multiple places in your face. You tell me if it's soft. If you feel the sharp side, then you let me know that. So I'm going to have you close your eyes. Soft, soft, sharp, sharp, soft, sharp, soft, soft, sharp, sharp, soft, sharp. Okay, very good. So that tells me that those cranial nerves, your facial cranial nerves, are intact. Next, I'm going to just have you make some faces at me. Shut your eyes really tight. Okay, really wide. Okay, open your smile a little big. Crunch your teeth. Right, crunch. Yeah. Stick out your tongue. Move side to side. Puff out like a fish. Very good. That tells me those cranial nerves are also intact as well. So next I'm going to do is I'm going to be looking at your eyes more intently now. So what we're going to do, we're going to check your what we call the 6 cardinal fields of gaze, and that checks your cranial nerves of 3, 4, and 6. Okay, follow my pin line. And those are grossly intact. So now what I'm going to do is I'm going to check for accommodation. I want you to look at a far enough distance. And then when I tell you to look at my pin line, I'm looking to see if her pupils will constrict. Okay, and now look at my pin line. And they do. And that is what we call good accommodation. Very well. So now I'm going to be looking for direct and consensual pupil response. I'm going to be flashing a light your eyes twice, twice on each side, okay? And she has intact, direct, and consensual pupil response. Exactly what we'll be looking for, okay? The next one I'm going to be doing is I'm going to be doing an ophthalmoscope scan. This time I'm going to be looking at her optic nerve, your optic disc, to see if make sure it's round and flat, that there's no cupping. Look at her arteries and her veins in her eyes to make sure they're not bulging, okay? So I'm going to have you look straight ahead, checking for red reflex. And there it is. Very good. And it looks very well side. Now I'm going to do her left side. There's the red reflex. Okay, and that is also very well. Okay. So next, what we're going to do is I'm going to do her. I'm going to go onto your nose and your ears. Okay, first your nose. So I'm going to inspect your nose. I already did that part, and now I'm going to look at inside your terminus. Okay, your terminus are intact. They're nice and pink. And it's a slight deviation in her septum. So I just want you to close one nose, breathe, on the other side. And there's no flaring, and there's no obvious distress when doing that. So next, I'm going to be looking at your ears. Here, I'm looking at the back of your ear to see if there's any creases, cracks in the back of your skin. There isn't any. I'm looking at her external ear canal. There's no swelling, there's no redness, no cracked skin. Does that hurt when I pull on it? No. Very good. So I'm going to look inside your internal canal. Landmarks I can see. And her genetic membrane is purely in white and shiny. And a little bit of earwax. Back of her ear again, her skin is nice and tacked. No creases and tacked skin. Any pulling? Okay. Okay, there's no tenderness. Her external canal, there's no edema, no swelling. Skin's totally intact, and it's pink and dry. I'm going to take a look. Her genetic membrane is purely and shiny, and there's no bulging, no redness noted. Very well. So next, what we're going to be doing is called the wine and winter test. I'm going to be putting this on top of your head, and let me know if you hear it in both ears, one ear, or the left, okay, or the other ear. Okay. Okay. Very good. So next, what we're going to do is called the Rhine test, and it's a bone to air conduction, and we're checking that cranial nerve to see if it's intact. It's number 8. Okay, let's do the other side. The bone and air conduction test is mostly intact because the air conduction is a lot longer than the bone, and that's what we expect. Now I'm going to do what's called a whisper test, and that's just going to check your, make sure your hearing is completely intact. Okay. I'm going to say a word in one ear and a word in the other ear. Just please repeat it. Cat. Bone. And her hearing is completely intact. Very well. So now what you want to do is I want to have you bend your head back. Okay, down, back, okay, side, and side. Very good. Shrug your shoulders for me, get the resistance. Very good. Those cranial nerves are also intact, and you have good resistance. So now what we're going to do is I'm going to check the rest of your, I'm going to check your neck and your rest of your lymph nodes. This is your deep cervical chain and your post-cervical chain, your pre-cervical chain, and your subclavian chain. And there is no swelling noted. I'm checking that her trachea is totally midline, and it shifts easily to the left and to the right. So I'm going to check in your carotid pulses. And the other side. Okay, so I'm going to be checking your thyroid. I'm going to shift it to this to the left, and I want to have you swallow. There you go. And again, the side. Very good. I feel no masses on where the thyroid is, and it's moving freely like it should. And then I'm going to listen for any breweries in that area. Okay, I'm going to slide your trachea over just to here. And again, this way. And no breweries are noted at that time. So I'm going to go down, and we're going to look at your upper arms and your strength. First, I'm going to go to the axillary. Just relax. I'm checking these nodes. And no swelling. And there's no swelling. Now, epilotter, the nodes behind the elbow. And no swelling there as well. So let's check your strength. I'm going to have you tighten your arms. I'm going to try to push them in. Don't let me. Push them out. Push them up. And down. Very good. Her strength is 5'5". Checking your pulses. There. And your brachial pulses. Bilateral. And they are +2. And they're bilateral and equal. So I'm going to check deep tendon reflexes in your brachial. And they're intact. Now we're going to move on down, and now we're going to look at your chest and your spine. So we're going to do your posterior first, and then your back. So actually, as I'm looking at her spine, I'm looking for curvature. Her curvature is normal. It's somewhat curved in here, and then it goes inside. There's some curvature in the back. It's completely intact. Her skin is pink, warm, and dry, and there's no open areas at all that I'm seeing. So first, what I'm going to do is I'm going to have her take a deep breath, and her respiratory excursion is equal bilaterally. And I'm going to oscillate her lung fields. So I'm going to have to take a deep breath in and out through your mouth. Again. 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 And again. I know no respiratory distress, which means no heaves or lifts. Her lung fields are clear to auscultation. Next, I'm going to have you, I'm going to palpate for tactile firmness, which is a vibration that should be there. I want you to say 99.
99.
Again.
99.
Again.
99.
And again.
99.
And it's equal bilaterally. Next, I'm going to palpate down to see if there's anything that's consolidating in your lungs, okay? So I'm listening for resonance. And and it's equal bilaterally. Next, what I'm going to do is I'm going to be checking what's called diaphragm excursion. Okay, so I want you to take a deep breath for me. Okay, that's fine. Okay, what I'm noting is I'm going from resonance to dullness, and it's about right here. So I'm going to do on this side now. Okay, take a deep breath. Very good. So so now what I'm going to have you do is I'm going to have you take a deep breath and blow it all out. And this should, very good. Now this side, take a deep breath in, blow it out. Awesome. So what I've noticed is her right side is a little bit higher than her left, which is totally expected because of her liver, and it's about 3 centimeters, which is within that range of diaphragm excursion, where it comes up and down when she breathes. And that is what I'm expecting. Now I'm going to have you turn around. So now I'm going to listen at your lateral lungs and your upper lungs. So I'm just going to slide right in there. Take a nice deep breath in and out. And again, on this. And you feel a stethoscope. Very well. So next what I'm going to do is as I'm listening for, I'm going to be listening at your heart signs. There's 5 different areas I'm going to be listening for. Okay? And at the same time, I'll be kind of listening for the lung sounds at the same time. So just breathe normal. And I'm going to go to right here. To the mitral valve area. And mid-ventricular. Your heart is regular, and on your S1 and S2 as I should. Very good. Now I'm going to have you lay down. And at this time, I'm looking for jugular distension, and I do not see any. I'm going to be listening to your heart sounds, but this time I'm going to be listening for any additional heart sounds. And then I'm going to, at this time, I'm going to palpate for her point of maximum impulse. Okay. And we're going to be listening for any additional heart sounds. Okay. Okay. And now what I'm going to have you do is I'm going to have you hold your breath. Okay, breathe out. And again. Okay, very good. She has no S3 or S4 noted, and which is, I would be shocked if she did. Okay, so now I'm going to go down to her abdomen. First, I'm inspecting her skin isn't totally intact. I do see the linea nigra down the center of her abdomen. Just by looking at it, I see no masses or protruding, anything protruding. So I'm going to listen for vowel sounds. sounds are positive in all 4 quadrants. Next, what I'm going to be doing is I'm going to, first I'm going to palpate for, your liver and everywhere. I should be expecting some symphony. Okay, first I'm going to start down here. By doing that palpation, I palpated the borders of her liver, and from what I could tell, it's about 6 centimeters, and that is what totally be expected. Next, what I'm going to be doing is do a light put in. That was percussion, and now I'm going to do the palpation. Okay, so just lightly. I do not feel any masses. And now I'm going to go a little deeper. And as I go deeper on this one side, I want you to take a nice deep breath in. Take a deep breath in. Okay. Take a deep breath in. All right. And what I'm having her take a deep breath is to see if I can have that liver rise up, and so I can actually feel it. And I can feel a little bit on the right side, and I cannot feel the spleen, which is not uncommon. I can't feel her aorta pulsating. And I believe that the direction is up and down. Okay, now I'm going to listen for any breweries in your renal arteries, your iliac arteries, and your femoral arteries. Okay? I'm going to go left to right. And no breweries were noted. I'm going to undo your jeans just a little bit so I can get to your inguinal area. So right now I'm going to palpate for her nodes. And there is no swelling. And then I'm going to listen for any breweries. And there aren't any. Okay. And while I'm here, I'm going to go ahead and go down. I'm looking at her skin on her legs. It's slightly cool, but she's been wearing shorts, so that's not unexpected. It's pink and it's dry. I'm feeling for her pulses and her popliteal underneath her kneecap. Okay. Post-tibular. And her dorsal pedius. And these are +2, and this is a +1, which is not really totally unexpected at this time. So this is looking really well. So next thing I'm going to do is I'm going to look at her range of motion of her legs. I want her to spin her legs up. Bend your knees up, and out, and down. Same way with this, up, out, and down. She has really good range of motion of her hips. Did that hurt anywhere? Good. Awesome. Okay, so I'm going to have you sit up. So I'm going to check her deep tendon reflexes and her popliteal and her Achilles. Do that. Very good. Of course, lay intact. Now your Achilles. and they're grossly intact as well. So, a couple other things that we're going to do. I'm going to listen on your carotids and your thyroid for any worries, and then we're going to do a final neuro exam. Okay? So first. No worries. I'm going to do your trachea. And slide your trachea over. Very well. And there's no worries there as well. So what I need you to do now is when I'm going to have you take your heel and rub it across, yeah, that way. Very well. And then what I want you to do is I want you to follow me. I'm going to have you go like this as fast as you can. Very good. And her reflexes and your speed is grossly intact as they should. Now what I need you to do is I want to check your fine motor skills, and I just want you to go finger to thumb. Okay. Very good. And the other hand? Very good. Your fine motor skills are grossly intact too. If you stand up, I'm just going to have you stand on one leg, the other. Okay, this is checking for balance to see if there's any abnormalities that I'm worried about with your balance. Now if you close your eyes, see if you sway or any. No swaying, that indicates a negative Romberg test, and that's exactly what we're expecting. Okay, at this time, I have to say her physical exam is completely normal. Thank you.